how do we make sure we A, keep our skin okay, and two, how do we use these creams?
People treat creams like moisturizers.
Huh.
Creams are also very strong medications at the end of the day.
Are they okay? Are they not okay? Are there side effects?
Why use a suppressive medicine? Why not cure it? Steroids are not curative in nature.
So are you saying that for some things it is okay, for some things it is not okay? Overuse is a problem. Where is the problem?
The problem needs to be diagnosed. भाई आपको एक्ने है, आपको पिगमेंटेशन है, जो भी उसको डायग्नोज करके ठीक करना है. मेडिसिन बस अवेलेबल है मार्केट में. ये पिंपल का ट्रीटमेंट है ही नहीं ना. When you stop that steroid, there are actually withdrawal symptoms that happen. The skin reacts, the original condition worsens.
For the common man, I don't know which is steroid based and which is not.
Yes.
So are there any names?
The problem of steroid mostly here is dependency.
So skincare is a very important part of our life, and a lot of people, because of small skincare issues, go to a dermatologist, which they should, and then come back with a cream and lotion, and a lot of these are steroid-based creams. Should you use them? Should you not use them? What is the pros and cons of them? They're all coming with all the government approvals. They are pharmaceutical, so they've been tested. But are there any problems in using steroid-based creams on your face? We are very lucky to have Dr. Atula in our studio. Dr. Atula is a dermatologist who's an expert in this field and has worked with a lot of patients, especially for skin, hair, nails, and related things. Dr. Atula, thank you so much.
Thank you for having me.
So the question I have for you today, it's a very focused question on one area, which is steroid-based creams that people are putting on their faces.
That's right.
Right? Now, dermatologists, doctors are recommending them.
That's right.
So, are they okay? Are they not okay? Are there side effects? How do we make sure we A, keep our skin okay, and two, how do we use these creams?
Okay, let me answer that for you. So, a steroid, a lagane wala steroid, which we call as a topical steroid, is a very commonly prescribed medication by a skin doctor, correct? But this is a prescription only medication. However, the problem that we are facing in India currently is that we do not have any licenses around the sale of these medication, which means that the pharmacist is freely able to sell them on a previous prescription, or even if a person goes without a prescription कि भाई रैश के लिए कोई क्रीम दे दो, मेरे को एक अंडर आर्म में रैश हो गया, मुझे क्रीम दे दो. So the pharmacist is going to prescribe that steroid to the patient, and the patient will keep on applying it. Now, this is causing a lot of problem for us because the steroids have a lot of side effects, basically. So, when used under prescription, they are good, which is your question mostly. And when used self-medicated, they are bad.
But the use is the same, right? So, are you saying that for some things it is okay, for some things it is not okay? Overuse is a problem. Where is the problem? Because ultimately it is a medicine.
Yes, ultimately it's a medicine. The problem is self-use, overuse as in prolonged use. Let's say I have given a cream for 5 days and then I write on my prescription, this cream twice a day for 5 days, then stop. STOP, stop, means stop. People treat creams like moisturizers. Creams are also very strong medications at the end of the day. We have to treat them like a dawai. We have to treat them like a medication.
But I guess the point is I brought a cream, I had a rash or acne or pimple or something, uske upar I put the cream, now my rash went away or my pimple went away. Then I had another pimple.
Yes.
So it's okay for me to put there also, right?
So that is where the problem is. So what happens is, let me tell you a little bit about steroid.
Yeah, what is steroid?
So steroid is basically an anti-inflammatory medicine which suppresses immunity. It's an immunosuppressant.
Okay.
जब हम इसको oral form में लेते हैं तो ये immunity suppress करता है, which is why it is used to treat a lot of autoimmune conditions.
Okay.
Right? And when we give it in skin, it is also used to treat a lot of autoimmune conditions. Let's say eczemas, psoriasis, विटिलाइगो जो ल्यूकोडर्मा होता है,
Okay.
जिसमें व्हाइट स्पॉट्स आ जाते
Yeah,
हैं
yeah,
बॉडी पे,
yeah.
वी यूज इट टू कंट्रोल 90% of the skin diseases because 90% of the skin diseases are autoimmune in nature.
Okay.
But then coming to your question, that is where they need to be given for a fixed duration, controlled dosage. Dosage भी important है
Right.
कि and steroid creams में सब potency होती है, mild steroid, moderate steroid, strong steroid.
Oh.
Now a steroid for a baby is completely different from a steroid that is given for an adult, or a
Right,
steroid
right.
given for the face is completely different from a steroid given for the body area. A steroid given for the groin area is completely different.
Okay.
सो फार्मासिस्ट को ये बात पता नहीं है. नाउ लेट्स से यू स्पोक अबाउट एक्ने. एक्ने में ये है कि एक्ने का मेडिकेशन मैं एंटी एक्ने मेडिकेशन से करूंगी ना. देयर इज अ स्पेसिफिक ट्रीटमेंट फॉर एक्ने. व्हाई यूज इट? व्हाई यूज अ सप्रेसिव मेडिसिन? व्हाई नॉट क्योर इट? स्टेरॉइड्स आर नॉट क्योरेटिव इन नेचर. स्टेरॉइड्स आर सप्रेसिव इन नेचर. ये प्रॉब्लम को दबाते हैं.
Got it. Got it.
That is why every pharmacist is out there for profit or for whatever reason.
Sure.
Sale of a steroid because he knows कि अगर उसने वो दवाई दे दी तो बंदा ठीक हो जाएगा, पर वो लॉन्ग टर्म ठीक नहीं हो रहा है. वो लॉन्ग टर्म प्रॉब्लम परसिस्ट करेगी, विच इज वाई द प्रॉब्लम नीड्स टू बी डायग्नोस्ड. भाई आपको एक्ने है, आपको पिगमेंटेशन है, जो भी उसको डायग्नोस करके ठीक करना है. दैट इज.
तो एक तो आप ये कह रहे हैं कि when you have a problem, don't just go to a pharmacist and pick what he is giving you. Go to a dermatologist.
Absolutely.
Go to a doctor who's studied that, who's experienced that, who will give you something and tell you how long to use it for and how many times a day to use it for and so on and so forth.
Yes.
Second, once you've applied it on one pimple and that's gone,
Yeah.
don't just jump it and apply on other parts of your face, because see, finally, what does a young girl or boy or even middle-aged person want is to look good.
Absolutely.
Right? So everybody wants their skin to look clear and clean and shiny and all that.
Yes.
Now, so when a pimple emerges or acne emerges or all those things emerge, we want to either hide it or ideally remove it.
True.
Right? That's what people want.
True.
So अगर किसी ने उसको one part of the body में लगाया and that is benefiting,
Yeah.
then they want to other parts of the face also and put the same thing because they say, oh, this is making my skin clear and clean.
Yes.
But you are saying that is not the case.
This is where the problem is.
Okay.
Because ये पिंपल का ट्रीटमेंट है ही नहीं.
Okay.
ये मेडिसिन बस अवेलेबल है मार्केट में. ये पिंपल का ट्रीटमेंट है ही नहीं ना. मैं बोल रही हूँ कि पिंपल को मैं टॉपिकल एंटीबायोटिक, पिंपल इज अ पस होता है ना पिंपल में, तो उसका ट्रीटमेंट अलग है. तो उसको मैं एक एंटीबायोटिक से ठीक करूंगी, उसको मैं प्रॉपर फेस वॉशेस से ठीक करूंगी, उसको मैं एक रूटीन बताऊंगी आपको कि यू शुड क्लेंज योर फेस दिस वे, और यू शुड नॉट पुट हेवी क्रीम्स ऑन योर फेस जो आपके पोर्स को क्लॉग कर दे या नए पिंपल्स बना दे.
Got it.
Pimples are hormonal. Acne is very hormonal.
Got it.
So I will check your hormones. I will see if you have this condition called polycystic ovaries, जो कि women में इतनी common है.
अच्छा.
PCOD बोलते हैं हम.
Okay.
So I will check for all that, which means that I am coming to a diagnosis. I am not just debauing the problem, basically.
So you're saying let's assume, going back to pimples, that you have pimples.
Yeah.
And you have PCOD.
Yeah.
There could be a connection.
There is a 100% connection.
Oh.
Most of the times.
Connection.
Oh yes. Most of the times there's a connection.
Oh, okay. Okay. And one could be the cause and the other could be the consequence, or they are just connected?
No. So when you have PCOD, then the clinical symptom of PCOD is acne. तो अगर
What's
आपको
a symptom of PCOD?
Yes, PCOD has tiny cysts in the ovaries, correct?
Okay.
And that leads to hormonal changes in the body, and जिसकी वजह से you can get unwanted hair on the face.
Okay.
Which is why people come
Sure.
for that. You can get hair loss from the head.
Okay.
You can get acne on the face. So these are all, or you can get, infertility, you can get obesity.
Got it.
So many times we see these young women and we can look at their body type and actually figure out that probably she has an underlying hormonal imbalance.
Okay.
So when I'm trying to say, sir, that whatever we need to correct, we as medical doctors should be able to diagnose it, and the problem of steroid mostly here is dependency also, because steroid kya karta hai, once you start applying it, it gives such a quick fix, it's such a quick fix that people have a tendency to abuse it. It's like almost we explain it like a cigarette, like, a smoking addiction or an alcohol addiction. Because, when you stop that steroid, there are actually withdrawal symptoms that happen. The skin reacts, the original condition worsens. So when you're talking about acne, or let's talk about, let's say somebody wants to get fair and they apply the steroid cream. Now, initially for 2-3 weeks, they'll get better, better, better. What will happen after 2 months is that they'll feel, I'm all good now, let me not apply this cream. They'll stop that cream. Suddenly, they will go dark.
Oh.
Because now is the withdrawal of, now the skin wants it. अब skin को वो दवाई चाहिए.
Oh.
So it is basically, we call it like it's actually quite poisonous. But because of this whole issue of unlicensed free availability, over the counter availability in the market, ये बहुत बड़ा issue है हमारा, that self treatment is really a problem for dermatologists today. And we actually, you won't believe it, we actually have task forces in between our colleagues. We have communities which are working towards this, that how to stop this topical steroid abuse, because the government does not have regulations कि आप पुराने prescription पे वापस दवाई कैसे खरीद रहे हो.
Right.
Why don't you go and consult your dermatologist?
So you're saying, one, when you're putting steroid, only do it under prescription. Second, when you're putting steroid, be aware that there is a side effect to the medicine. So if you're doing it for too long,
You will get side effects.
so what is that side effect?
Yes, I will explain that. So, let me talk about कहाँ use होता है ये. We see topical steroids, लगाने वाले steroid creams, being commonly used for fungal infections. Correct? Now somebody has this jock itch, right? Somebody has a rash in the groin area, which is a fungal infection. What is somebody who does not want to come to a doctor, they'll go to the pharmacist, they'll say दवाई दे दो boss,
Right.
and they will give a steroid cream. Now this gets immediately better, and over जब ये use होता है, the skin gets thin. So one side effect is the skin gets very thin. It can develop stretch marks. So you can actually get, because skin thin हो गई ना, so now it gets pulled.
Right.
So the skin, because of thinning of the skin, there are stretch marks that develop. The second thing is that this can, because it's suppressing the immunity of the skin, other infections can arise, which means boils हो सकते हैं वहाँ पे.
Okay.
So, something that we call bacterial infection, like funsi,
Right,
phode,
right.
funsi, dane,
Right.
all of that. Then people use it for pigmentation, tanning. People use it for, छाइयाँ हम बोलते हैं, like जो mask of pregnancy होता है, when you have patches on the cheeks. People use it for that. उसमें we have seen this problem that the skin goes very red.
Okay.
एकदम red हो जाती है, thin, पेपरी थिन स्किन. आप सोच सकते हो दैट द स्किन जैसी होती है कि टच करने में भी जलती है, वो एकदम पेपर की तरह थिन हो चुकी है वो. इट हैज लॉस्ट द थिकनेस बिकॉज द स्टेरॉइड इज थिनिंग द स्किन. सो इट गेट्स सेंसिटिव, इट गेट्स रेड, इट बर्न्स, when you apply anything on the face, it develops hair on the face. And इस particular चीज को हम बोलते हैं टॉपिकल स्टेरॉइड डिपेंडेंट फेस. सिंपल टर्म कि स्टेरॉइड से डिपेंडेंट हो गया है ये फेस. So these are the common side
that
effects.
stage ना आप उसको बंद कर सकते हो, ना कंटिन्यू कर सकते हो.
Absolutely. तो इसमें हम क्या करते हैं सर, that ideally, right, this requires a lot of counseling.
Oh.
ठीक है? Because now what I'm doing is, I'm doing a de-addiction program.
Oh my God.
I'm actually, it's like a rehab program that I'm doing. Now I'm telling the patient that आपने जो चीज़ लगाई है, ये आपको अंदर ही अंदर से खराब कर रही है, ऊपर से आराम दे रही थी, but अब खराब कर रही है. Now we have to stop it. And when you stop cigarettes or when you stop alcohol, you have withdrawal.
Yeah.
You crave it.
Yeah.
The same way your skin is going to crave it and it's going to react. So what it's going to react is that it's going to get even more itchy. It's going to get even more red. और बर्न करेगी और परेशान करेगी, दाने निकलेंगे. तो ये पूरे रिएक्शन फेज में चली जाएगी एक तरीके से.
Got it.
And now I cannot even give that cream to suppress it. So now here is the part of patience. So then we manage it with the right moisturizer कि भाई अब 2 हफ्ते बैठो ये ऐसे ही रहेगी अभी. Now you have to do the de-addiction program. And then slowly we start giving barrier repair. हम skin के क्योंकि वो barrier खत्म हो गया, पतली हो गई skin.
Right.
तो we start, giving the correct kind of moisturizers, hydrating agents, जिससे वो skin का barrier repair हो जाता है.
Okay.
And धीरे धीरे वो skin अपनी thickness फिर gain करती है, which may take months together. So this is one thing for us. And obviously फिर हम पहले steroid से निकाल के patient को, फिर हम उसकी ओरिजिनल कंडीशन मैनेज शुरू करते हैं कि हाँ अभी आप स्टेरॉइड से बाहर निकल गए हो, अब मैं आपकी एक्ने ठीक करती हूँ.
Oh.
So you see how self-medication complicates.
Got it. Yeah. Wow. Okay. Thank you so much. This was very useful. Hopefully, a lot of people will benefit. And I will go and tell a lot of people about this. And hopefully, a lot of people will watch it and learn from that too.
Sure. Thank you so much.